Hey everybody, my name is Dr. Vince Gutierrez. I am a physical therapist. You can find me at movementthinker.org. I practice out of the Joliet, Illinois area. If you have any questions, comment below. That's cool. So far we've covered introductions. What do you do for a living? What do you do in your free time? Describe your symptoms to me. Where are your symptoms? How long have they been there? What makes them better or worse? Are they constant or do they come and go? And why did they start? Okay. So next, we're going to cover time of day. Does time of day have any effect on your symptoms? And I typically ask the question that basic, right? Because if time of day has an effect on the symptoms, they're usually going to say, and sometimes I'll say it depending on like how well that person in front of me is communicating. And so if that person comes across as having a lower educational level, right? They're just struggling to communicate, which is fine. That's what we do. We have to change our communication levels based off of our patients, right? And I've got a podcast on that. I'll link it to this. That's fine. If that patient is struggling to understand the question, then I will ask very specifically, does your symptom change in the morning? Does your symptom change in midday? Does your symptom change at night? And, if you're worse in the morning, well, then it could be what you did before you went to bed the previous night. It could be just from laying in one position for 8 hours. It could be that you just aren't sleeping well, right? There's a lot of possibilities for why you could be worse in the morning, and that's fine. This is just, it's data, like I said before. It's all information that we're going to try to take and compile into one big answer to this puzzle that is your back pain to give you a treatment that's going to best help you in the shortest amount of time. If your pain is worse at the end of the day, it could be that you've had a long day, you've either been immobile or you've been really mobile. There's the time of day, we have to ask some further questions about that as to what did you do during your day that could be making it worse at night. And when I ask those questions, I like, dude, tell me your life story. I want to know. And if I feel like we are running low on time, I'll push this along, right? But aside from that, you tell me everything and let me figure out what's relevant or not relevant to your case, what's related or not related to your case. And some patients they don't want to over-inform, but sometimes I want to be over-informed, and then let me figure it out and weed through the information to try to come up with the solution. Do your symptoms change from being still versus moving around? There are some types of problems that create symptoms such as pain, numbness, tingling that prefer movement, right? And then there are other such problems that don't like movement. Right? I mean, if you break your arm, you're not going to be out there, pulling on a lawnmower string. But, if you have a nerve problem, you might have trouble staying still. You might keep waking up at night and moving around. So the type of problems that you have typically present with their own patterns. Next, is your sleep disturbed? This is actually a big question. So this is an important question. And this needs to be asked on every eval. It doesn't matter what you're going to see. Is your sleep disturbed? This topic is blowing up over the past, I think it was 2017 that I read the article in a PT journal. But it's been blowing up for the past few years. I recommend anybody who's out there go, and I'll try to link it to this, just go watch Dr. Kirk Parsley. He explains this stuff very simply and easy to understand terms. But if you're not sleeping enough, you could be coming across as cognitively impaired. You don't want to do that, right? If you're sleeping too much, you could end up with heart issues. But, if you're not sleeping enough, this could have a relationship to your pain. And that's why it's really important for us, because it could play a role in your symptoms. And so if you're having chronic pain and you're sleeping 3 hours a night, there's this thing the body produces that's called substance P. I just like to call it substance pain because it heightens your sensitivity to pain. And so not sleeping is not good, right? That's basic. Not sleeping, not good. Try to get that 7 to 9 hours of sleep a night. And at this point, if the patient is telling me they're getting less than 6 hours of sleep a night, 7 hours of sleep a night, we start discussing some sleep hygiene stuff. Do you have electronics in your bedroom? Are you drinking caffeine before you go to bed? What are you eating before you go to bed? Are you becoming hypoglycemic during your sleep? Is your sugar all over the place because, you ate cookies before you went to bed and it greatly raised your blood sugar and then it dropped and now you got hungry and you need to get up and you got to go to the bathroom? So yeah, we have these discussions in the clinic. And again, your therapist should be touching on this stuff. They should know this. The information's out there. It's not hidden. Patients can find it. Like I said, go check out Dr. Kirk Parsley. We want to know why is your sleep disturbed? Because, I mean, I'm not trying to scare anybody, right? But this is a big red light for us. If your sleep is disturbed, we really do have to dig into that, because there are some issues that can disturb your sleep that they need to be looked at by somebody who's not a PT. And that's fine. There's nothing wrong with us referring you back out. And one of the big topics that gets discussed as a red flag for difficulty sleeping and pain driving you out of bed is cancer, right? And again, it's nothing for you to be afraid of. It's just data. Everything is data. I can speak to my career, it's been 12 years now. And in 12 years, I have had 4 patients whom I was the first one to suspect cancer. And again, it's just data. There's a ton of data out there, and we have to figure out what data is relevant and which data is not. And so, those 4 were sent back to the physician. And there were some patients where I suspected something not good, right? I never suspect cancer, but I'll suspect something not right, and I refer them back, and there's nothing wrong, right? And that's awesome. It is much better to be safe than sorry. And so I have no problem referring the patient back to make sure that everything has been cleared before they see me. So if you're having trouble sleeping, we want to make sure that that's not a big red light for us and that we need to refer you back. This could also be just you don't like the position you're sleeping in. And if you change positions and you go back to bed, then that's not really a big deal for us to start off with, but we still take mental note of that. We still jot it down because it may come back to be something that we have to pay attention to. I didn't realize I was going to spend almost the whole 6 minutes talking about sleep. So the next 2 questions here lie into sleep themselves. So I'll finish off here. What position do you prefer to sleep in? And what position are you sleeping in now because of your symptoms? I personally, I'm like a rotisserie chicken, right? I mean, I'm just all night long, I'm back, stomach, side, back, stomach, side, back, stomach, side, back, stomach, side. I mean, it's covers, it's like taking covers, and I'm like a little burrito by the time I wake up in the morning. And that's cool. Some people have that. I have that. It's fine. It's not a pathology. No, it's fine. Kidding. But other people, they're like casket, and they don't move. They just don't move. I heard a story recently on a podcast. I'm a wrestling fan, for those of you that don't know. And there's a famous wrestler by the name of Arn Anderson who could sleep like this in one position with a can of pop on his belly and sleep like that for 8 hours, and the can of pop will never move. So I just thought that was kind of interesting. But some people sleep like a mummy or sleep like a casket, right? And that's just the way that they sleep. And so we need to know, 1, are you waking up? And if you wake up, can you change positions and go back to bed? And then the final thing that we want to know is, are you on a firm mattress or a soft mattress? If you're on a soft mattress, have you tried sleeping on the floor, and did that change your symptoms? If you're on a firm mattress, did you try curling up maybe into the fetal position, and did that change your symptoms? Because the type of mattress that you have will change your posture a little bit when you're in bed. It's not huge, but it will change your posture a little bit. That'll be the end for this one. I've covered just sleep in this little video. So thanks for watching. Stay tuned for the next video.